Hi, I'm Samira, and thank you for being here. Today I'm going to walk you through panic disorder. Not just what it looks like on paper, but what's actually happening inside the brain and the body when someone experiences it. We're going to explore how panic is tied to our fear circuitry, our nervous system, as well as our stress hormones, and why it can feel so overwhelming. I'll also touch on some of the most effective treatments and how culture plays a role in shaping how panic is experienced as well as healed. My hope is that this gives you a more grounded, integrated understanding of panic disorder, both through science and through the lived experience of what clients actually go through. Let's begin by getting clear on what panic disorder is and how it shows up. So, what is panic disorder? It's a type of anxiety disorder where people experience sudden, intense episodes of fear that seem to come out of nowhere. These aren't just moments of worry, they're actually full body surges of panic. The heart races, breathing gets shallow, the chest feels tight, and many people think they're having a heart attack or even dying. Even though fear is a natural protective response, in panic disorder, that fear is misfiring. It's like the brain and the body are hitting the emergency button without a real emergency. Research has shown that panic disorder isn't just in the mind, it's linked to chemical imbalances, a hypersensitive nervous system, and overactive fear pathways in the brain. Now that we've defined it, let's go a little bit deeper into what's actually happening inside the brain and body during these episodes. So what's happening inside the body during panic? First, the brain's fear system is on high alert. The amygdala, which is the part of the brain that scans for danger, is overly active. It's firing off alarms even when there's no real threat. Normally, the prefrontal cortex and hippocampus would step in to calm things down and add context. But in panic disorder, those areas tend to underperform. That's why people can feel out of control even when they know logically that they're safe. The nervous system also gets stuck in overdrive. The sympathetic branch revs up, causing a racing heart, rapid breathing, sweating, while the parasympathetic system, which helps us calm down, doesn't kick in as easily. It's like the brakes aren't working. This dysregulation isn't unique to panic. Similar patterns also show up in other conditions like autism spectrum disorders, which suggests that there may be a shared sensitivity in how the body responds to stress. On a chemical level, people with panic disorder often have low serotonin, excessive norepinephrine, less GABA, which normally calms the brain, and as well they have disrupted cortisol patterns. So we're talking about a whole body reaction, the brain, the nerves, and hormones, not just thoughts and feelings. Next, we're going to look at how all of this connects to the classic fight, flight, freeze response. So the fight, flight, freeze response is the body's built-in alarm system. This system evolved to protect us. When there's real danger, the brain triggers a flood of adrenaline and stress hormones, preparing the body to either fight, run, or freeze in place. Your heart races, breathing speeds up, muscles tense. All of it is designed for survival. But in panic disorder, that system gets activated when there is no actual threat. Someone could be sitting in their car or lying in bed and suddenly their body reacts like they're being chased. That's where it becomes terrifying, not because of what's happening around them, but because of what's happening inside of them. Over time, people start fearing the sensations themselves, the dizziness, the chest tightness, which then triggers more panic. It becomes a loop. That's why treatments like interoceptive exposure and breathing retraining are so important. They don't just address the thoughts, they actually retrain the nervous system to respond differently. Let's take a closer look now at what causes panic disorder in the first place, the underlying factors that set all of this in motion. So where does panic disorder actually come from? It's not just one thing, it's a combination of biology, genetics, and the way someone thinks about their body and emotions. Some people are born with a nervous system that is more reactive. they feel things more intensely. And if panic or anxiety runs in the family, there may also be a genetic link as well. But biology alone doesn't explain it. A huge part of panic disorder is how the person interprets what's happening inside of them. For example, if someone feels lightheaded and immediately thinks, I'm having a stroke, that interpretation itself can trigger a panic response. The fear of the sensation becomes the danger itself. We also know the stress system, the HPA axis, tends to be overactive in people with panic disorder. And new research shows that inflammation in the body might play a role too, especially in people with anxiety sensitivity or a history of trauma. Put all of this together, sensitivity, wiring, misinterpretations, and a body that doesn't regulate stress well, and it's easy to see how panic can actually spiral. Now let's explore what happens when panic disorder doesn't show up alone, when it overlaps with other conditions which can also complicate the picture. So panic disorder often doesn't occur alone. It's very common for someone with panic disorder to also struggle with depression. Sometimes the panic comes first and the depression follows after months of living in fear. Other times it's the reverse. It's also frequently linked to generalized anxiety or agoraphobia, where the fear of having another attack makes people avoid certain places or situations. But comorbidities aren't just psychological. Panic disorder takes a toll on the body too. So if someone is having repeated surges of adrenaline and elevated heart rate, it can put long-term strain on the cardiovascular system. That's something to really pay attention to, especially for clients who already have health concerns. There's also the issue of substance use. It's not uncommon for people to try to cope with panic by drinking or misusing sedatives. And while that might bring temporary relief, it often makes things worse in the long run. It increases risk, it masks symptoms, or it can create new problems altogether. This is why an accurate assessment is so important. If we only treat panic without seeing what else is going on, we can miss opportunities for more effective and safer care. Next, let's look at some evidence-based treatments that actually can help. So let's talk about what actually works when it comes to treating panic disorder. The gold standard in therapy is cognitive behavior therapy, or CBT. It helps clients recognize and challenge catastrophic thoughts, like believing a racing heart means that they're dying, and gradually face the sensations they fear. This is where things like interoceptive exposure comes in. This is where clients purposely bring on those sensations in a safe setting to retrain their body and brain not to panic. Breathing retraining is also another important part. Panic makes people breathe fast and shallow, which can actually worsen their symptoms, so learning to slow down the breath helps calm the nervous system. On the medication side, SSRIs like sertraline or paroxetine are often first-line treatments. They're generally well tolerated and effective. Benzodiazepines can also be helpful in short bursts, especially during acute episodes, but they carry a high risk of dependence, so they're not recommended long-term. There are also some promising adjuncts. Heart rate variability biofeedback helps people learn to regulate their heart rate and calm their body. Mind-body interventions like mindfulness, relaxation techniques, and even gentle yoga can be powerful tools for relapse prevention and overall nervous system support. But treatment doesn't stop with the individual. That's what we're going to be exploring next. So beyond therapy and medication, what else helps? One of the biggest pieces is psychoeducation. When someone understands that their symptoms are connected to a dysregulated nervous system and not something shameful or dangerous, it can immediately reduce fear. That sense of, oh, this makes sense now, is often the first step towards healing. Support systems also matter. Whether it's a friend who gets it, a group setting, or even an online space that feels safe. Feeling less alone can make a big difference. For some clients, culturally grounded support spaces or religious communities are where they feel the most seen. Family psychoeducation can also help, especially in collectivist cultures, when loved ones understand what panic disorder actually is, it reduces judgment and increases support. And in more complex cases, especially where there is comorbidity, it's crucial to have interdisciplinary collaboration. That might mean therapists, doctors, and psychiatrists all work together so nothing slips through the cracks and clients are truly supported on all sides. But even with all this in place, treatment won't land unless it feels culturally safe, and that's what we're going to dive into next. So this is something that's often overlooked, culture. Even though the physiological experience of panic might be universal, how people describe it, understand it, and seek help for it can be totally different across cultures. In some communities, panic is felt more somatically, so someone might say, my chest is heavy, or it feels like I can't breathe, instead of I'm anxious. In other cultures, the experience may be framed spiritually. It could be seen as a punishment, a test, or even possession. And these meanings shape help seeking. Instead of turning to therapy, some might go to a religious leader or traditional healer first, especially if there's stigma around mental health. That doesn't mean they're avoiding care, it just means that they're trying to make sense of their suffering in a way that feels most true to them. And as therapists or clinicians, it's our job to meet clients where they are. That might mean adapting our metaphors, adjusting our language, or co-creating exposure hierarchies that fit their worldviews, not ours. When we make space for culture, we build trust, and trust is everything. Let's bring it all together now with some closing reflections on why panic disorder is more than just anxiety and what truly effective treatment looks like. So to wrap things up, panic disorder isn't just about anxiety. It's a full body experience. We're talking about a dysregulated nervous system, hyperactive brain circuits, low serotonin, and thought patterns that convince the body that it's in danger when it's actually not. What makes treatment effective is that it works across multiple levels. CBT helps challenge those catastrophic thoughts. Interoceptive exposure retrains the fear response. Medications like SSRIs support neurochemical balance, and approaches like HRV biofeedback or mindfulness help restore calm to the nervous system. But even more important, effective care is integrative, it's trauma-informed, and especially culturally responsive. It sees the whole person, not just their symptoms. It honors biology, belief, and the stories people bring into the room. As research keeps evolving, we have more and more tools than ever to help clients not just manage their panic, but feel safe in their bodies again. So that concludes my presentation. Thank you so much for being here with me today. I do appreciate your time.